Hello everyone, welcome to the case taking sessions. Today we will discuss what are the common mistakes we commit while taking the case, while solving the case. Homeopathy is a very beautiful science. If you are artistic, if you know how to deal with the case, then it's very simple. Many people, many doctors think that homeopathy is a very complex, it is very difficult to solve. But actually, it is very easy. But the thing is, so many people don't know how to deal with it. So that is the reason we commit mistakes while taking the case. So today I will try to explain few things while regarding the case taking in the part of this course. So listen to me carefully, my friends. Close everything, whatever there in your hand, in your surroundings. Just listen to me. This will really help you in your practice. Some points may look like a very simple things, we know this. But these are the things we often forget while taking the case. So these are the very, very important things you need to remember. The first mistake we commit, overemphasize of symptoms. When a patient comes to you, we take all the case, whole case in detail, and we go for the repertorization and we put all rubrics together one after other. Fever, forehead, heat, hands, cold, thrustless. What happens when you put all the rubrics at once? You will get a lot of medicines. And it is always, obviously, it would be very difficult for you to select one remedy. So that is the reason we should not put every rubric in the repertory. Every symptom as a rubric in the repertory. That will confuse you. So how to deal with it? First of all, when the patient comes to you, take a paper and make 3 columns. In first column, write down the disease of the person, especially in acute conditions. And second column, write the symptoms. And in third column, write the peculiar symptoms. So as a physician, you should know very well about the diseases and what are the common symptoms which occur in that particular disease. If you don't know, if you don't have the knowledge of that disease, you should definitely acquire that knowledge. First, you need to be a physician. You're all the homeopaths, qualified homeopaths. I'm sure you all have that knowledge. So when the patient tells his symptoms, write down the disease symptoms, all the disease symptoms in one column, and peculiar symptoms in other column. That will help you to solve the case. For example, if a patient comes to you with a fever, typhoid fever, what are the symptoms, common symptoms you get in the typhoid fevers? But first you need to understand that. In typhoid fever comes at particular time and in a increasing temperature, increasing ascending order. Patient may have headaches, body pains, nausea, vomiting, maybe a loose motions, weakness, lack of appetite, thirsty. Maybe in some fever, some people feel thirsty and some people not. So you should write down all the symptoms. These are all the common symptoms. Every typhoid patient will come and give you these symptoms. You should not repertorize these symptoms. What are the peculiar symptoms? If the patient says that I get a fever every hour, the same time, maybe that may not be the peculiar symptom. But if the patient says, I feel thirsty, but whenever I drink, I feel shiver, and after that, I vomit, and the vomiting is a bitter in taste, then it gives the complete clue to the medicine with a lot of bone pains. Then it is a clue to the medicine Eupatorium perf. But if the same patient comes to you and says that I feel chilly, I get a fever every day, 3 p.m., and I vomit, which is sour, acidic, then that may be the case of the lycopodium. But if fever may come, coming in the same time may not be the peculiar for you. But if the patient is exact when the clock meets just comes to that particular portion, when this clocks just rings at 12 o'clock or 3 o'clock, if that exactness is there, that may be the peculiar symptom. Loose motions may not be the peculiar symptom. But what is the color? Is it offensive or the sore? Maybe the peculiar symptom. Weakness may not be the peculiar symptom. But when the patient is feeling weak, when the patient is getting the fever, when the patient is shivering, how often the patient is feeling thirsty, which varies from every patient to patient. That peculiar symptoms are so very important in our case. You need to repertorize those cases. More the peculiar symptom, more the important. For example, if one patient came to me and he said that he get a vertigo, and after that he get perspiration, and after perspiration subsides, his vertigo vanishes. It's ameliorate. This is a very peculiar state. Forget about the typhoid, forget about the whatever may be the disease, but this symptom is a very peculiar type, and which is not common in any disease. This is not the disease symptom. So you need to pick this as a rubric. Search for this symptom in the repertoire. And the natron self is the medicine and which relieve all the symptoms in just a span of hours, couple of hours. But you should not, if one rubric matches, you should not prescribe that medicine blindly. You need to ask, and either you need to check whether the other symptoms, at least 2 or 3 symptoms, are matching with the patient or not, especially in the acute conditions. So that is the one thing you need to remember. Never repertorize all the symptoms, rather repertorize only the peculiar, well-known, confident symptoms, means physical symptoms which are very which are visible to you, which are facts, rather than giving the mind symptoms imagination, especially in the acute cases, unless until the mind symptoms are so very prominent. Take the facts, take the help of the facts. Facts will help you to reach the right remedy, but you need to understand which facts you need to be considered. The symptoms which are not much related to the disease are very, very important symptoms. So the second mistake is negative matching of the remedy. If the patient comes to you and the patient gives all the symptoms of the pulsatilla. He's he's sleeping, he's moaning, and is very attention seeking, and the physical symptoms are also uh, matching, but the patient is at thrusting. Then we think how it can be possible. Pulsatilla patient is always thrustless. 80% of the cases it is true. Pulsatilla cases are always thrustless. But if the patient comes to you who is constitutionally a calcareocarp or an axvomica, but at that particular point, after having the ice cream or maybe the pastries, patient's state is completely changed. Most of the symptoms are matching with the pulsatilla, but one symptom is not matching. Maybe the medicine may not give you the complete relief to the patient. He may require the other remedy which is underneath that particular medicine. Maybe that may be a calcareocarp. But at that point of time, maximum symptoms, peculiar symptoms are matching with that particular medicine. Then go with that medicine. That will help you to towards the cure. So that is the very important thing you need to understand. You will not get all the symptoms in one person, especially in acute conditions, maybe in chronic cases also. You need to artistic which medicine is more prominent in that particular patient. The more prominent medicine you need to select. One more thing is that if you get some symptoms which are known to you, if two symptoms are matching, we cross check all the symptoms with that particular medicine. Again, that is also very wrong thing. When some medicine comes in your mind while taking the case, just write down that medicine in the paper and just put the pen down and just listen to the patient. And if other medicine comes, then write that medicine as well, until you take all the case history. Never come or never put a negative opinion or never cross check that medicine with other medicine. If you get 2 or 3 main prominent symptoms in acute cases, then you may see to confirm the medicine. But if you are getting a general general weakness, general thrustlessness, if you are not 100%, patient is not saying that yes, I am completely thrustless, I am feeling I can't talk with you, and patient is just talking like them. This is the one expression which I often get in the pulsatilla patients. They do something like this. If you ask any question, they just do like this only. Until you get some very, very peculiar symptoms, you should not go to that medicine. If the symptoms are the common symptoms of the disease, on the basis of that, one of my students asked me, can I give a ammonium cart because the patient is the heart problem, while ascending the stairs he is feeling a breathlessness. You can't give, because the patient is a heart facing cardiac issues. Definitely he will feel a problem while ascending the stairs. This is not something which is peculiar in that case. You should analyze the case on the basis of the more peculiar symptoms, or at least you should take the whole case and consider the totality. Peculiar symptom is something which is not related to the disease, but the patient is still having that particular behavior or the particular symptom. Then you should, that is a very anchor. If you get the anchor, then you can trust and you can cross check the medicine with other medicine. Other than that, just on the basis of some common symptom, you should not guess the medicine. If the patient is drenched in a red, he has body pains, it is quite common. Should not just give a Roostox until you get all that stiffness and the triangular tip on the tongue. and that restlessness, until you don't see that in particular medicine, you should not give just on the basis patient is drenched in the rain and he got a body pains. It is the very common symptom. For example, if a patient comes to you and you are taking the case, he said in the past history, which comes in the ignorance of the etiology. The third point, which we often commit mistake. We ask what happened in your past history. The patient says, my mother expired. Oh, we just fix it. Mother expired and the patient is ill. We should give the medicine which is related to the grief. That is a very, very wrong thing. Every person's expression to that particular situation is very different. You need to understand how it affected the patient. So this question is very important. If the patient comes to you and you ask him, he says that my mother expired 6 months back and after that this disease started. Now you need to ask how it is affected you, how your mother's death affects you. That is very important. What is missing? What he is missing? Someone may tell you that I miss the love and the care which is given by mother. I am so attached to my mother. She is the one who takes care of me. I always want to talk with my mother. Now that affection is missing. That people comes to falls under some other medicines. Now I feel so grief. I am not attached to any other person. Mother is the only one whom I attach to her, and I share all my secrets with her. That case may be the natrimor. If the patient says, mother is the only one whom I attach to because I can't do anything without her. I am not capable of doing all these things, all the modern world. My mother is the one who used to guide me. I don't even know how to operate a mobile, how to operate a phone, how to operate a washing machine. I am totally dependent on my mother because my brain, I don't have that much of a mental evolution. So I need the support, intellectual support of my mother. Now mother is not there. Now what should I do? That may be the case of the Barreta group of medicines. I explained clearly about the Barreta group of medicines in my session 2, I think. Old participants know about this. So knowledge of the materia medica is so very important. And one more patient comes and says, it's a very big shock to me. My mother expired. It's a shock. I was just numb. I did not cry. It's a very shock. That may be a Luganaceous shock. Maybe a ignatia. One patient, I still remember, he used to come to me for his renal stones. His renal stones gone, means very homeopathic medicines helped him a lot. Still he continues to come to my clinic. Reason behind that, he recently lost his mother and he needs a guidance always. He needs the guidance. For that guidance, he can't take any decision. Confusion of a mind. Should I follow this person or should I don't follow? What should I do? What type of a clothes? What type of work should I join? He needs the suggestion always. To take the suggestions, he comes to my clinic even after getting well. So the confusion is so very important. Dependency on others' support is so very important. You should take such rubrics in that particular person, that because he is not missing his mother, he is missing the person who suggests him, who gives idea what to do, what not to do. Since childhood, he don't have that much of a confidence on him. He always depends on the people, even parents. Which course should I join? Which job should I join? Which dress should I wear? Now he is missing that. That is completely a different medicine. Now, write in the comment section in the group what is which medicine I prescribe to that particular person. That is a task for you. Write to me. I will disclose in a group only. So this is one thing. So the next thing is, so you should not ignore the etiology. You should understand what is the facts behind that. How far, and some patient comes to you and you asked him what happened. Did you had any vaccination? And the patient says yes. 10 years back, a vaccination. I took vaccination. But that vaccination is not affected the patient. How vaccination is affected? After vaccination, any symptoms develop? If there is no symptoms, if there is no any relation or connection with our present disease and the past histories, then you should not consider those points in your repertorization unless it is if there is a prominent role of that particular action, then only you should consider that. One patient comes, she lost her mother, but there is no any that much of impact on her. No, okay, lost, she is fine. She did not get any illness because of that loss. Just happened a few months back. It's not means that you just pull that in your rubrics. And no, if it is affecting, then you need to ask how it is affecting. If there is a loss, how it is affecting. If there is a pain, how it is bothering you. These are the very, very important question. How every person's description varies if you put this type of questions. Mixing of the symptoms layers, I already told you. Mixing of symptoms means if the patient is a calcariacar, he has all the symptoms of the calcaria, he passes stool once in a 4 days and he feel better while constipated, and he has lot of a perspiration, sour perspiration, he loves the eggs and the chicken, but suddenly he gets some illness after having some food and his symptoms completely change to the pulsatilla or maybe the nux vomica. But still the patient is having this perspiration. Still the patient has the craving for the eggs. You will confuse. Are I am getting a partial some picture of the calcarea carb and partial picture of the particular pulsatilla or the nux vomica. Which medicine should I prescribe now? You need to ask one question. What happened after the disease? The symptoms which developed after the disease state are very important. Some patient says, I am a thrustless, but in this fever state, after this disease, I feel thirsty. So this thirsty is very important symptom. Rather, the symptoms which are present previously or the before the disease are not that much of important, especially when you are dealing with the acute cases, or if you are dealing with the chronic cases but the symptoms are acute. If the patient comes to you in an acute state, acute symptoms, then you need to concentrate on the present predominant symptoms. If the patient is thirsty, generally he is not thirsty. If you ask, are you a thirsty or thirstless, he may say you this, no, I am not thirsty, I am a thirstless. But since this fever, I am feeling a thirsty. Which symptom you collect? This thirsty, this present symptom is so very important. If the patient say, I am if you ask a general question like, are you thirsty or thirstless? He say, I am very thirsty. I drink 4 or 5 liters in a day. But since yesterday, I am not feeling it. Thirst, I had only 1 glass of water. Disease state, thirstless need to be considered. Patient, if you ask, did you pass in acute condition, you need to ask, did you pass the stool today, yesterday? Need to be asked. Whether you ask, are you constipated, he will say, no, no, I pass stool regularly, I don't have any problem while passing the stool. This is the general symptom. Generally, he is not a constipated, but at the time of the disease, he is a constipated. If the constipated and the patient has a gastric issues and the slightest motion gives troubles, there is a lot of irritability is there, you want to take a rest, bryonia is the medicine, which often we may confuse. Maybe he is not actually bryonia constitutionally, but the disease says he is a bryonia. That is why since 2 days only he is not passing a stool, or even he generally passes a normal stool, he is passing a hard stools. There is a lot of dryness in the mouth. So this condition, this overlapping symptoms, you need to understand, my friends. Present predominant symptoms are so very important if you want to deal the acute cases, especially these COVID times. You need to concentrate on what is now, what she used to be. You need to compare it. Generally she is a thrustless, or this time she is thrustless. Generally she is constipated, or now she is constipated. If there is any differentiating symptom is there, that symptom you need to be considered. So predeterminating hierarchies means you should not prejudice. Means if you are giving a medicine in a pandemic, everyone requires the bryonia or arsenicum. Should not put that in your mind. Maybe that person is a hyperself, or maybe the Merxol. Should keep yourself vacant and collect the symptoms. Prescribe it. You should have good knowledge on materia medica, like Allen's keynotes, Anand Chaudhary materia medica, Bork materia medica. If you not joined my courses materia medica series, you should join it. I explained in depth how to what are the main symptoms and how to remember. Also, I explained everything. If you are not the part of my courses, you should definitely join in that. So because knowledge, materia medica knowledge will really help you at the time of repatriation also. You are getting a 3 or 4 symptoms, medicines, it will help you to differentiate at that particular moment. So last one where we commit a mistake, lack of understanding of the pathology. You should know thorough knowledge about it. If the patient comes to you, which organ is affected? What is the reason behind that? What are the habits which are a reason for the deterioration of the health? Need to be understand, my friends. Definitely you should concentrate on those areas. What is the disease? Cancer. Why? How? And what are the symptoms of the cancer? What are the symptoms of thyroid? What are the symptoms of diabetes? Need to be understand how to deal with this. You should fix their diet plan. If it is a chronic diseases, you should deal with the patient. And one more very important thing, you need to understand which symptom appeared first. Need to be understood, need to be taken care of. As I'm talking to you, physical symptoms are more important, especially in the acute conditions, but sometimes mental picture itself is acute. For example, a lady came to me for stomach pain. I asked her how it is started. She said that one of my relatives promised me that he will come to my home by evening for lunch, for dinner, but he did not came. I asked her how it is affected. They are not giving my value. They should come to me. It affected me a lot. I got hurt. And the attendee said she keeps on abusing them. She prepared everything with her own hands. She needs everything in time. She's a very workaholic. Now he is not present. Now all the gastric issues developed. Remember, my friends, Naksvamika and Ignatia are from the same family. Both are emotionally. Maybe Naksvamika look strict, but they are in depth. They are very emotional people. They get affect. You can see that shock and that Ignatia type of a picture in Naksvamika also. That is the reason you should understand. Here the reason is because she got hurt. That is the reason. After that she developed all these issues. Naksvamika helped her a lot. Of course, the physical symptom is also matching. Sometimes physical symptoms come first. Injury happened, pain, lot of a pain, or some after drinking bad water, typhoid happened. Nowhere any related to the emotional or the mental picture, and later mental pictures developed. In that condition, it would be better to concentrate more on the physical symptoms rather than the mental picture, unless the mental picture is predominant. Remember this, underline this. If the mental picture itself is a predominant, take it. So it is very easy what the patient is saying, on which angle the patient is concentrating is so very important. For example, a patient comes to you in a chronic cases, like a diabetes. You need to ask when it is started. He say 10 years later. Patient will not talk about what happened 10 years before. That is you need to ask. In this condition, you should not directly rely on the patient. Means he is what the patient saying is it's enough to prescribe the medicine. No, it's not going to happen. In this condition, it is a very chronic disease which is continuing since the 10 years. You need to concentrate on that area which will never describe by the patient unless you put a question. What happened 10 years back and how it is affected? This would be the very important question in this case. But acute conditions is completely different. He comes in acute state. He will tell you what it actually bothering. In this condition also patient talk about the emotional aspects. Then you need to concentrate on it. If he is not talking, he is talking about the physical symptoms and you are getting the particular symptoms. Along with that, some mental pictures like the bryonia type of irritability, pulsatilla type of moaning, or the sensitivity like an Naksvamika, then you should take those symptoms if it is visible. What are the symptoms which are coming, which are in front of you, need to be taken care of. What is the reason behind that is very important, very important question. Why? After vaccination it is started, after drenching in the rain it is started, after taking a cold water it is, and these are the sensitive factors. And this sensitivity, why it is happening, how it is affecting, and what is the disease, what are the peculiarities. These 4 aspects is enough to select the medicine. So you should never commit these type of a mistake while taking the case. That's all for today. Next session I will come with some other topic. Thank you so much.